I decided to do my paper on cardiopulmonary resuscitation, or CPR, as everybody knows the term. On my paper, I decided to do quick research in how cardiopulmonary resuscitation works, how it's performing, and then why it's important to be performing in the pre-hospital, and then why it's important to be performing by bystanders as well. So that way we all will prepared for this. On the first part, it's about why does CPR important. Cardiopulmonary resuscitation is important because it will keep the blood flow through the body, around the body. But the most important thing is it will perfuse the brain, giving some oxygenated blood to the brain. So this way the perfusion is still going through the arteries, and they will give oxygenation to the brain. Even if the flow of the CPR is not performing pretty well, the patient will still have some pretty good outcome if the CPR is performed with a few minutes as the patient goes into cardiac arrest. I'm gonna briefly introduce you and explain you why it's CPR, how it's best performing in children and adults, and what the good outcomes from performing CPR is. I'm gonna give you some helpful information. What is CPR, or cardiopulmonary resuscitation? CPR, or cardiopulmonary resuscitation, is an emergency life-saving procedure. This procedure is performed when the heart suddenly stops, and then it has to be performed immediately, right when the heart stops, so that way it can double or triple the chances of survival of the patient in cardiac arrest. In the Medical Heart Association, they had created critical steps on the management of CPR by creating the following chain of survival. This chain provides 6 critical steps to follow when cardiac arrest occurs. So this way people can get an early idea of what they can expect, and what they can do to help their loved ones. How cardiopulmonary resuscitation is performed. There are many ways to how people can perform CPR, but there are two main ways that they will give the patient a better outcome in early CPR when it is performed. This is for adult patients. The first one is for the healthcare providers and the ones that they are already trained on CPR. The controversial CPR is used chest compression and rescue breaths on the for the healthcare providers. At the ratio that it needs to be provided, that will be 30 compressions and 2 breaths, 30 to 2. And this is performed for adult victims in cardiac arrest. At this rate, the compression will give a rate equal to 100 or 120 compressions per minute on the adult body. But the most important is the depth on the compression, how they are performing. It has to be at least 2 inches or 5 centimeters deep on the adult chest. So don't be worried you're trying too hard. As hard as you go, you can break their ribs or do anything, but try to do as better as you could. So this way, it will bring a good outcome to your patient. The number 2, it's for the general public and adult patient, general public or bystanders, that they might have witnesses the cardiac arrest. They perform the compressions that will be hands only. This means that you don't have to perform mouth-to-mouth breath, but it's only is to be encouraged to do by bystanders that witnesses the cardiac arrest out of the hospital setting. For example, like at home, at work, or in public, when there is just one bystander that witnesses the cardiac arrest. If there is 2 people over there, one of those can start calling for ALS or EMS. And then the other one can start chest compressions. And then if there is two people in there, one of them can do chest compressions and another one can give a rescue breath. The performance of cardiopulmonary resuscitation in pediatric patients is almost the same as adults. If you are about to perform chest compressions on a child, you are by yourself and no one else is there to help you, you should start by checking the consciousness of the baby. You can call them by its name and ask if they are okay. And then you call quickly check if the children is breathing by try to get your head down to the mouth of the baby on the nose, and with your eyes you can see the chest rising or fall. And then if the children have no response, the next step is start performing chest compression. This place in a child will be place the child on a back or on firm flat surface, and then just knee by the side of the child, the baby, and start to do chest compressions by placing 2 fingers on the breastbone and push down about 1.5 inches or about 1/3 or 1/2 of the dip of the children's torso. Do 30 compressions, let the chest to completely recoil between pushes. Then check if the children has already started breathing. then you could go around them 5 cycles as well as adult patients, but you have to have called ELS or advanced life support already, so they will be underway by the time that you finish up giving the chest compressions. But never stops until they arrive. Chest compressions on children, so when you have 2 or more patients at the scene, I could be performing 15 compressions and 2 breaths, and then you have to keep doing the same thing until the children's regain ROSC or the ELS has arrived. Overall, cardiac arrest occurred and it's an electrical disturbance in the heart that makes it stop. The use of the automated external defibrillators or AED in the case of sudden cardiac arrest victims increase the chances of survival of this patient. And a study made by the Johns Hopkins University by the medical students Rolls Pollock, the research looked at almost 50,000 people treated with cardiac arrest in the EMS between 2011 and 2015. The patients that were in cardiac arrest that happened in public outside the hospital, witnessed by bystanders, and were shockable. This means that their hair beat is still good enough that the activity will respond to the defibrillator shock. The research found that 66.5% survived with the help of bystanders administering the AED, versus the other 34% who survived after waiting for an emergency crew to deliver the shock to their hairs. Similarly, cardiac arrest patients were more likely to return to the normal neurological level of assistance by bystanders who uses the AED instead of waiting for the EMS. An estimate of 3,459 additional lives will be saved each year in the United States if they perform. If the CPR is already started by bystander witnesses who witnessed the cardiac arrest in public, and they were able to use the AED. Overall, I'm just trying to show you how CPR is performing in adult and small patients, so children, and then by explaining how the procedure needs to be performed in and outside of the hospital. In that way, a better outcome for those patients. Cardiac arrest gets how how good the outcome for those patients cardiac arrest could get by the performance of CPR in the pre-hospital or the hospital settings. And then I'm trying to encourage you to help always CPR. And then I also put some statistics to try to show you how important is that you guys learn how to perform CPR. So let's hope we never need it, but whenever we need it, we'll be ready for that. And then in conclusion, the performance of CPR is important because this way you're giving a better chance to get a good outcome on your patient. So just have in mind that by knowing CPR, you could know how to save a life. Thank you.